Indiana Newsdesk is made possible in part by Hoosier Energy, providing electricity to southern and central Indiana electric cooperatives and their member customers. Information at hepn.com. And by WTIU members. Thank you.
Right now on Indiana Newsdesk, there are more than 1,000 dams in Indiana, many of which are at risk of failing. Who's responsible for their upkeep?
I'm retired. I'm living on a fixed income. I didn't plan on, several $1,000s going out for a dam inspection.
There's a lot of finger pointing going on in one Indiana neighborhood. How the fight is likely to come to other communities as the state works to document more dams in disrepair and improve safety. Once a cesarean, always a cesarean? Why some doctors say maybe that recommendation isn't best for mothers or babies.
After my C-section, I ended up developing a fever, and we ended up both on IV antibiotics. And so we were in the hospital for almost a week after my C-section.
Plus, the state superintendent walks out on her own meeting. Why she is blaming the governor for the dysfunction at the State House. Hey! Those stories and a look at this week's headlines right now on Indiana Newsdesk. Hello, I'm Joe Wren, and welcome to this week's Indiana Newsdesk. Well, nationally, only 27,000 people have enrolled in the federal health care exchange. In Indiana, the number is 701. Those numbers the Department of Health and Human Services released this week are far below what the Obama administration had predicted. Here's a look at some other numbers in Indiana. Nearly 32,000 people have completed applications. Of those who have applied, more than 11,000 qualify for Medicaid or the Children's Health Insurance Plan. And another nearly 8,000 are eligible for federal subsidies. And that's a lot of numbers, so to help us understand the data, we now turn to Chris Schrader. Thanks for being here today. So what happens December 15th if not enough people sign up?
Well, very serious things. First of all, you will have a majority of people not having health insurance on January 1. That's the immediate implication. So the stated objective of the act will have not been met in substance. They extended the time that an individual have to enroll, select, and get into a plan, if you will, all the way till the end of March. So the upfront date is December 15. That's to have coverage on January 1. But there will be people enrolling over the course of the next few months. Really, the next date after December 15 is March 31. That's important.
Now, we said 701 Hoosiers have signed up, but have they actually paid? Because a lot of what we heard is that they're surprised at how much the plans cost.
Yes, they are. And no, we really don't know how many have paid. And my expectation would be that not many have yet. Because spending cash well in advance of when you have to isn't something that people normally do. But you bring up a very good point. There's a big distinction between, in an e-commerce lingo, a shopping cart having a product in it and then actually purchasing that and having it go through. We need to see those numbers going into December. I think if in November shopping carts are still full and you haven't seen a lot of payments being made, then there'll be real concern there.
Now, is there a point that the health exchange may just fail at some point, especially if there's not enough younger people signing up?
Yes, ultimately, whether the federal government is doing it or individual insurance companies are doing it, risk only works if your pool is constructed in such a way so that it can sustain itself. And the fear right now is that you won't have enough of the right mix of bodies in the exchange to make it work. And this is what the insurers are concerned about, because so far of the people who are actually enrolling, they are skewing older. So right now, the early mix is not good.
Now, Obama just announced this week that he's going to push back health insurance coverage for those who were going to lose it till 2014 or so.
Right.
Does that help Hoosiers?
It may or it may not. That's very murky at this point. First of all, again, I need to emphasize what the president has taken is discretion on enforcement. The underlying law remains the same. And this is going to be a critical factor with the 50 insurance commissioners. Each individual state has an insurance commissioner who is going to look at this and decide if they even want to allow it. Washington State has already said they won't. That was 2 hours after the president spoke, and Washington State commissioners said no. So if the commissioners don't approve it, it won't happen. Even if the commissioners say they'll go for it, if the insurance companies don't want to create products they can only sell for a handful of months, it won't happen. So I'm not optimistic this will have the intended impact.
Well, and people have until December 15th to select and pay for a coverage to be able to get it by January 1st.
To get it by January 1st. And so if you're an individual who's in a continuum of care and you want to have coverage, you need to act quickly.
Thank you very much.
Thank you.
The clock is ticking for residents in an Indiana subdivision to come up with a plan to maintain 6 dams in their neighborhood. After more than 20 years, the State Department of Natural Resources discovered the dams and found they had critical structural issues. The DNR told residents it was up to them to find a way to make repairs. With thousands of dollars on the line, there's a lot of finger pointing. And as Sarah Whitmire reports, this situation is likely to happen again as more non-regulated dams show up on the state's radar.
If you could choose the most perfect spot in Indiana to live, Leon Husky says his neighborhood north of Peru would top the list.
Living here is like coming home to a resort every night. With the lakes, the trees, we have so much wildlife here.
For 18 years, he's lived here in his dream home in the northern part of the state.
When I purchased the property, I bought 2 lots. One lot was a lakefront lot, the other lot was just adjacent to it. But nothing was ever discussed about dam ownership or inspections or anything, so total surprise when we received the letter.
A letter from the Department of Natural Resources in September said there was a problem with the dams in the subdivision. They hadn't been permitted properly when they were constructed more than 20 years ago. They hadn't been inspected since their construction, and they weren't being maintained. The
letter implied that the residents were the dam owners and that we needed to come up with some plan on inspection, repair, annual inspections or whatever. They kind of were putting that directly on us.
According to the DNR, there are 6 unpermitted dams in Husky's subdivision, and they're all classified as high hazard, meaning they could cause loss of life or property damage if they're breached.
People have unfortunately built many that they either didn't get permits, didn't go through appropriate processes, and there are likely dams of a size to be regulated that we don't know about.
Smith says it's a common misconception that the government owns most dams. In reality, about 70% of dams across the country and in Indiana are privately owned. 26 state-owned dams are in poor or unsatisfactory condition. The number of privately owned dams in the same condition is more than 15 times that number, at more than 400. Private dams are required to go through the same inspection process and maintenance procedures as government-owned dams. The question becomes, who pays for that?
Dams can be sort of a money pit for people.
To complicate matters in Peru, the county maintains roads over some of the dams, so there's a question of ownership and whether the county has a responsibility to pay for some of the maintenance. Just the inspection will likely cost at least $20,000, and the state requires that be done every 2 years. That figure doesn't take into account completing the actual repairs.
We are potentially looking at possibly hundreds of thousands of dollars to get this done. I don't have hundreds of thousands of dollars to put into this.
It seems the most viable option residents are considering is the creation of a conservancy district, basically a special taxing district that would raise money to support a water resource. It's a fairly common thing. Here at Lake Lemon, residents worked with the DNR to establish a conservancy district in the mid-90s.
All of these homes and people that own them pay what we call a special benefits tax to the Conservancy, which is in addition to their normal county taxes. Normal county taxes go for schools and highways and police protection, and the tax that we collect goes strictly towards the maintenance of the reservoir and to maintain it as a beautiful natural resource.
The tax generated $250,000 last year, but that's with roughly 525 homeowners contributing. There are fewer than 40 homes in the Peru subdivision. And it wasn't easy to establish the Conservancy District. It took 4 years to circulate a petition, get signatures, file the plan in court, and get a judge to sign the district into existence. The residents in Peru have until the first of the year to let the DNR know what course of action they want to take.
State rules outline the owner's responsibilities when a dam is being constructed. In the case of the Peru subdivision, the dams were built when the residents bought the lots and they didn't realize they owned part of the dams. Some of the residents are hoping the DNR will grandfather in their neighborhood, but the state hasn't been too willing to consider that, saying it's their job to make sure people who live downstream of the dams are safe. And now for news headlines, we go over to Alex Dirkman, who has more on this week's top stories. Hi, Alex.
Hi, Joe. Thank you. The owners of a piece of property on Lake Monroe that was clear-cut say they will restore the land and pay fines imposed by the county. A kayaker last month saw the clearing and notified authorities. The property owners say they hired a contractor to do some bush hogging, but he cleared the property all the way to the shoreline. Because the U.S. Army Corps of Engineers owns the land around the lake, the property owners violated both county and federal law. The Monroe County Planning Department plans to evaluate the property to determine what needs to be done to restore it. The amount of fines imposed on the property owners will depend on the outcome of that investigation. Corn yields in Indiana are expected to top 1 billion bushels this year for the first time. According to the USDA's November crop report, the previous record was 933 million bushels set in 2009. But farmers won't see higher profits. They paid more for seed this year, and the price they're expected to get for selling it is about half of what it was last season. The Indianapolis City Council is calling on the General Assembly to defeat an amendment that would ban same-sex marriage in Indiana. The council voted this week to adopt a formal resolution opposing the ban. The city's mayor says he will sign it. If the amendment passes, it would then go to a statewide vote next November. Opponents of the ban say it would keep companies from moving to Indiana. Supporters argue the ban is needed to keep courts from potentially legalizing same-sex marriage. A group reviewing the role of the National Security Agency could have a preliminary report out by the end of the month, and an Indiana University law professor has some recommendations on what it should include. The NSA has come under scrutiny for collecting Americans' personal information, including phone records. IU cybersecurity expert Fred Kate says the government should consider splitting the agency into two.
Neither the public nor Congress is as moved by surveillance that involves everybody. And so even though this is much more broad, even though this is far more sweeping than anything the 9/11 attacks involved, Congress is just not as motivated to take action now. And so I think there's very little chance that we would see anything dramatic like that.
Kate says if the agency were divided, one section would make sure the United States cyber infrastructure is secure. The other half would collect intelligence data. Hoosiers paused this week to honor the men and women who have served our country. In Brown County, the governor dedicated a bridge in honor of a Marine who died in Afghanistan more than 3 years ago. Claire McInerney has more.
Hey! Oh! Hey! Oh! Hey! Oh!
Hundreds of people gathered Monday to honor Sergeant Jeremy McQuarrie, who died 2 months before he was scheduled to come home to his wife, Ray, and their infant son. Ray says she plans to walk along the bridge with her son when he grows up to remind him of his father.
Since my husband has passed, it's been a goal of mine personally just to keep his memory and story alive. So this is something that gives us a great opportunity to do that.
In a speech, Governor Mike Pence recognized McQuarrie's service, but he says the most fitting tribute to veterans is providing them with resources and making sure they come home safe. McQuarrie served 3 tours overseas, including 2 in Iraq and 1 in Afghanistan.
It seems to go against common wisdom, but some doctors are urging parents to expose their kids to more potential allergens. They say it will help them build up immunity to allergies later in life. The recommendations are coming on the heels of several studies that indicate exposure to potential allergens is good for children. One study found Amish children in northern Indiana have significantly fewer allergies than children living in the suburbs. The reason? Because they grew up on farms. Researchers say the studies beg the question, should we be living in such clean environments? And Thanksgiving is less than 2 weeks away, so it's time to start planning your meal. As you work out your budget, a bit of good news. It may cost less this year to put your feast on the table. That's because the price of turkeys has dropped. So while some Thanksgiving food staples such as cranberries and sweet potatoes are a bit more expensive, Joe, researchers from Purdue say in the end, the savings from your turkey could mean you have a little bit of extra money left in your pocket this year.
All right, very nice. Thank you very much, Alex. Coming up next on Indiana Newsdesk. Nearly a third of babies born in Indiana are cesareans, what the risks are and how the statistics are changing. What state board members did after the superintendent walks out of her own meeting and why she is accusing the governor of trying a takeover of the education department. Those stories coming up next on Indiana Newsdesk.
I can change the world with my own 2 hands, make it a better place with my own 2 hands. I'm gonna make it a brighter place with my own 2 hands. I'm gonna help the human race with my own 2 hands. I can hold you in my own 2 hands, and I can comfort you with my own 2 hands, with my own 2 hands.
Welcome back to Indiana Newsdesk. I'm Joe Wren. Nearly 1 in 3 births in Indiana and nationally is a cesarean section. Recent statistics from the Centers for Disease Control and Prevention show cesarean sections in Indiana at 38 weeks of pregnancy have dropped nearly 6% the last few years, but they've also increased by about the same amount at 39 weeks. Gretchen Frazee reports on what those numbers mean for mothers and their babies.
When Bloomington resident Rose Stewart had her first child, it wasn't easy.
My first pregnancy with my son actually was a bit of a complicated pregnancy. I ended up on bed rest for several weeks.
42 weeks into her pregnancy, Stewart finally went into labor with her son. But after 12 hours, doctors started to get worried. So she and her doctor decided to proceed with a C-section. Finally, her son Ben was born, but not without complications.
Immediately after my C-section, I ended up developing a fever, and we ended up both on IV antibiotics. And so we were in the hospital for almost a week after my C-section. And when I got home, I would say it took a good 6 weeks before I felt back to normal.
So when she became pregnant again, Stewart had to decide whether to have another C-section or opt for a vaginal birth after cesarean. Stewart says she studied the risks and ultimately decided she wanted a vaginal birth. That did not sit well with her doctor or some of her family members.
I got a lot of support up until about 38 weeks. And then I think a lot of my friends and family were kind of wondering, you know, why I wouldn't just opt to do an elective C-section. It was right around the holidays. My due date was actually Christmas Day. And so I think, you know, there was a lot of people sort of questioning our decision. And my care providers were supportive up until after I passed my due date. And then I did get a little bit of resistance from them.
Dr. Brian Cook was on call at Bloomington Hospital when Stewart went into labor. He was supportive of her choice, and without complication, she delivered a healthy baby girl.
It was just, I was thrilled with the final outcome.
And your recovery?
My recovery was 10 times better.
Stewart's struggle represents a larger trend. Beginning in the 1970s, doctors and health professionals began adopting a once a cesarean, always a cesarean mentality. Their recommendations were based on the risks involved with a vaginal birth. Some, like uterine rupture, were life-threatening.
Then, a few years ago, several hospitals around Indiana, including this one, started changing their policies on C-sections. Research indicated vaginal birth after cesarean did not pose as much risk as previously thought. And cesareans hold their own set of risks, including potential damage to organs and possible infection in both the mother and the baby.
A lot of the repeat cesarean sections that are being scheduled are now being scheduled for after 39 weeks. And so it's taking the same deliveries and just moving them back a week or so.
That gives babies more time to develop in the womb, but it hasn't dropped the C-section rate overall. One reason for that could be the role of health insurance. In the 1980s and 90s, some insurance companies wouldn't cover vaginal births after cesarean sections, effectively dictating what kind of delivery doctors performed. Dr. Cook says since he started practicing around 20 years ago, he's never felt that pressure from insurance companies. But insurance can still play a role. Indiana Perinatal Network Executive Director Larry Humbert says insurance companies reimburse C-sections at a higher rate than vaginal births, and that provides doctors with a financial incentive to perform a C-section. But he says that doesn't translate to lower costs for the patient when it comes to both medical bills and insurance premiums.
You look at from a medical complication standpoint for both the mom and the baby. If you look at it from a health cost standpoint, either short-term or long-term, I think it is absolutely something that we need to make sure that when it's done, it really does need to be done for medically appropriate reasons.
Back at her home, Stewart watches her 4-year-old son Ben read a book to her 6-month-old daughter Riley. She says when it comes down to it, women need to be well informed about all their options and then be allowed to make the choice for themselves.
And we now go over to Kyle Stokes with our State Impact Education team. Kyle, policy meetings typically seem pretty boring, but I gather that's not the case this week.
Not the case this week, Joe. And every week it seems like I come on and talk about new heights in the tensions between the State Board of Education and State Superintendent Glenda Ritz. But now there is Wednesday's meeting of the board, which State Superintendent Glenda Ritz abruptly shut down without a vote over a disagreement with the board. Here's what happened. Board member Brad Oliver made a motion to involve staff of Governor Mike Pence's newly created education agency, which now oversees the board and its budget, in reviewing the state's academic standards. Ritz blocked the motion. She says it was out of line, and she believes that agency undercuts her authority as chair of the board. So she blocked the motion, angering board members, and after about 20 minutes of back and forth, board member Dan Elsner called for the board to overrule Ritz, and that's when things really went downhill. Watch.
It's a genuine concern. It's a concern that was discussed properly, and I think we should just take the vote.
As the chair, this meeting is adjourned.
No, there has to be a vote for that.
This meeting is adjourned.
There has to be a vote on adjournment.
This meeting is adjourned.
Council, does that have to be a vote on adjournment?
You can't adjourn without a second, can you?
This meeting is adjourned.
You can't adjourn a meeting without.
It's not adjourned. I'm staying.
The meeting is adjourned.
It's not adjourned. So if you leave, we're going to continue.
The meeting is adjourned.
And with that, Ritz got up along with her staff and filed out as board members sat for the most part in silence, and making the scene all the more bizarre. Those watching live on the internet saw the video cut out as Ritz left the room. After consulting with their attorneys, frustrated board members withdrew the motion and moved themselves to adjourn. Ritz told reporters afterward she didn't blame board members themselves, but blamed the Pence administration for meddling. Pence expressed regret for the frictions and even offered to mediate. In a letter that he sent to board members, he said that he hopes that they can still work out their differences with Ritz. There was some actual education policy set at the meeting. Before all of the drama, board members agreed to the concepts of a new system for issuing A through F performance ratings to Indiana schools. But the board left much of the substance of the new model up in the air, leaving that to challenge to tackle later. The proposal the panel saw includes possible new statewide tests for 1st, 2nd, and 9th graders, an idea that many board members weren't buying. The state's top ethics official has filed a complaint against former state superintendent Tony Bennett, saying he used state computers for campaign business. The Associated Press published documents this summer showing Bennett's team kept a database of Republican donors on Indiana Department of Education computers. Bennett says he looks forward to working with the Inspector General to clear his name. And Joe, this obviously comes as part of the same huge dump of emails that the Associated Press published that got Indiana's A through F system in hot water.
All right, well, thank you very much, Kyle. This week is the 75th anniversary of Kristallnacht. In English, it's known as the Night of Broken Glass. The events of that night marking the beginning of the Holocaust in Europe. Tom Brinkman has the story of one Indiana woman who was there.
This week, Ruth Reeves is preparing her crafts to head to Columbus for the annual Deja Vu Fine Arts and Crafts Festival, but life was drastically different 75 years ago. The evening of November 9th, 1938, Ruth was walking through Berlin with her mother when their conversation was cut short by the sounds of shattering glass bursting into the streets.
I remember that furniture came out of windows, and my mother was smart enough to leave.
SA paramilitary forces and non-Jewish citizens burned synagogues, demolished Jewish-owned storefronts, and imprisoned thousands of Jewish citizens. Ruth's life was forever changed.
You had to follow some stupid rules. You didn't know why. Everything you had learned in good manners was now not for everybody, but for certain people, but they did not explain.
Ruth left Germany 13 years later and came to the United States in 1959.
I must say, because of my upbringing, I am very, very much against any kind of discrimination. I can go, if I just sense it, I can step in. And I'm not very nice about it because I have experienced it and I want this to be stopped.
Okay. Very neat story. Yeah. That's the end of this program, but our work continues online as we cover the news in southern Indiana throughout the week. It's all at WTIUnews.org. For Alex and Kyle and everybody at WTIU, have a great weekend.
Indiana Newsdesk is made possible in part by Hoosier Energy, providing electricity to southern and central Indiana electric cooperatives and their member customers. Information at hepn.com. And by WTIU members. Thank you.